Aliasing can be a difficult topic to understand on Doppler ultrasound, but I was trying to figure out a way to make it a little bit easier to understand. Aliasing is the inaccurate display of Doppler velocity when the velocity range exceeds the scale available to display it. And this is there's something called the Nyquist frequency, where if the Doppler frequency shift is greater than half the Doppler sampling rate or your pulse repetition frequency, then that's where aliasing occurs. It becomes difficult to understand where the velocity, the direction is actually going in. And so I thought of an easier way to kind of understand this. And this involves looking at a clock. When you have a clock, it takes about 60 minutes. It takes 60 minutes for the clock to go completely all the way around. And so if you end up taking 15-minute naps, and you just look at the clock every 15 minutes, well, you'll see the 12, then you'll see the 3, then you'll see the 6, another 15-minute nap later, you'll see the 9, and then you wake up again after another 15-minute nap, and it goes to the 12. And so you're able to accurately depict, just based off of seeing that it went from the 12 to the 3 to the 6 to the 9 back to the 12 again, that the direction of the minute hand is actually going in the right direction. It's going clockwise. Now, if we meet it at half the frequency, so the frequency in which it goes around is 60 minutes, if we start taking 30-minute naps, which are at half the frequency, that's where things get a little confusing, because if we take a 30-minute nap, we go from the 12, and then we look at it and we see the 6, and then we look at it and we see the 12. And again, if we've never seen a clock before, we don't really have any understanding of the direction in which things are going. It doesn't look like it's moving in a particular direction. Now, if we go greater than half of the frequency of the clock, now we're going to go at 45-minute naps. Now we're going to be in a situation in which things get even more confusing, because if we take a 45-minute nap, it goes from the 12, then we wake up and you see it's at the 9. We take another 45-minute nap, it goes from the 9, 45 minutes later will take us to the 6, another 45 minutes later will take us to the 3, and then to the 12. And so you can see, if we're taking 45-minute naps and we've never seen a clock before, we think that the direction of the minute hand is actually going in the reverse direction. And so this is what happens when you get greater than half the frequency in which you're sampling things. It gets quite confusing as to which direction you're going in. Now, if we go at 60-minute naps, it looks again like nothing's really moving. So we have no understanding in which things are moving. If we go at 75 minutes and we look at it every 75 minutes, we can see that it actually then goes back to our regular interval of clockwise flow. And so what ends up happening is the lengthier your naps are, it goes from normal direction to no direction, to reverse direction, to no direction, and then normal direction again. And we can see this actually in a number of interesting examples. Here's one where the helicopter looks like the blades aren't moving, but all that's happening is that the camera, when it's taking those individual images together, the frequency in which it's taking those images is the same frequency in which the blades are moving around, and so is not able to depict the actual direction of flow. Here's an example here where we're going to be looking at a wheel, and we're going to see that the wheel is actually going in one direction, and we'll see it slows down and then goes the reverse direction, and then slows down and then goes the forward direction. This is very similar to the clock analogy here, in which things are just getting faster and faster, but because we're dealing with limitations of how fast the camera is taking pictures, therefore it can inaccurately display the direction in which the wheel is moving. So how do we see this on ultrasound? Well, here's an example here of a transplanted renal artery. We can see that the scale here, which is akin to our pulse repetition frequency, is from 40 centimeters per second going towards the probe to minus 40 centimeters per second going away from the probe. And if we just look at this, it looks quite confusing. It looks like this flow going towards the transplanted kidney here, then away from, and then towards, and then away from, and then towards. And that doesn't really happen physiologically. What's going on here is that these are two areas here where the the velocity here exceeds 40 centimeters per second. So because it doesn't know how to depict that, it's going to scale, it's going to wrap around to the bottom here, and it's going to make it look like it's a reversing in flow in these two areas here. And this is actually can be useful. This artifact can be useful in trying to figure out, well, where are the areas in an artery where you see increased velocity. Sometimes this Doppler artifact can be useful, and these particular areas are areas of higher velocity, which can indicate areas of stenosis. And here's our MRI, where you can see there are two areas of near complete occlusion of the renal artery, which correspond with the areas of the high velocity that we see here. Here's another example here. Here's our right ovary, and then we have an artery right underneath it. And we can see this very interesting shape of it. We're kind of seeing a cross-section of the artery here. And when we look at it, it looks like there's blue, and then it goes to red, and then it goes back to blue again. And all that's happening here is that in a vessel, the slowest flow is always going to be on the edge because it's interacting with the vessel wall. And then as you get more centrally, it's getting faster and faster. But because here we're up against the scale limits here, which is from here 5 centimeters to minus 5 centimeters, because it's going more than 5 centimeters per second at this particular point, it has to wrap around and go on the other side of the scale and make it look blue. And I just put this scale side by side. I put two of them side by side, and you can see how nicely this correlates with the image that we're seeing here. Now you can see aliasing on spectral Doppler as well. Here you see the incorrect depiction of the direction of flow is now below the baseline here. We can fix this in a few different ways. One of them is you can change the baseline setting on the spectral Doppler image. That's probably the easiest thing to do. But if we go up against those limits, then you can increase the velocity scale, which is you're increasing your pulse repetition frequency. You can also use a lower frequency ultrasound. And then finally, you can increase your angle of inclination to try to fix aliasing. So let's look at a few examples here. Here's one where you can see there's aliasing going on here. There's incorrect depiction of this direction of flow here. Here you can see the baseline is quite high, so all I did here was drop the baseline here, and it brings everything to the appropriate direction of flow. Here's another one here where you can see aliasing going on the left. How did we fix this in this case? Well, here we mostly changed our pulse repetition frequency. Here is 1.6. It went up to 2.6. What does that do? That increases our scale on our spectral window here. Here we're going from about 40 centimeters per second to about minus 20 centimeters per second. So there's about a 60 centimeter per second scale here, whereas here we're going from about 60 centimeters per second to about minus 20 centimeters per second, or maybe a little bit more than that. So this is probably around a 90 centimeters per second scale. So this it's a bigger scale, which allows us to be able to to better depict the true direction of flow on this one. And then finally, the other thing we can do is we can also change the frequency of the probe. We can drop the frequency to increase the scale. Here we can see the frequency is at 3.1. The scale here is about 0 to 300 centimeters per second. But if we change our frequency, drop it down to 1.7, we can see here that our scale is now moved up to about 1,000 centimeters per second, and it can better depict the actual velocity on this particular image.